So hello everyone and welcome to the case 5 of this Osce series. Today we'll be discussing a very important Osce case. So here we have a 64-year-old male who complains of fever and upper abdominal pain since the past 1 week now, and I have provided a non-contrast axial section CT cut as well as post-contrast CT of the same patient. So based on these two images, what are the findings that are appreciated and what is the diagnosis? What is the diagnostic criteria for this particular disease on CT, and what is one differential that we have to remember, and how do we differentiate it from that particular differential? So I'll give you some time to appreciate the findings. So on this axial section of non-contrast CT, we can see that there is some fat stranding in the mesenteric region that is seen, along with some sparing of fat in the perivascular spaces. There is some mass effect also that is seen in the adjacent bowel. These are the post-contrast images. There is no abnormal enhancement as such that is seen. Again, we can see that there is sparing of the perivascular uh, mesenteric fat, along with some mesenteric nodes that are seen. So what do you think based on that? There is some mass effect, some sparing of the mesenteric, the perivascular mesenteric fat, some smudgy mesenteric appearance, giving a misty mesentery appearance. No abnormal post-contrast enhancement seen. Based on this, what do you think the diagnosis is? So the diagnosis here is sclerosing mesenteritis. There is smudging of the fat planes, which is seen surrounding the superior mesenteric vessels and the branches, which is typically called misty mesentery within the root of the small bowel mesentery, which is the most common site. There is accompanied several prominent mesenteric lymph nodes which were seen, and there was no abnormal post-contrast enhancement that was present. So coming to the diagnostic criteria on CT, it's called the Coolier's criteria, and Coolier's criteria includes 4 important signs for the diagnosis of sclerosing mesenteritis. Sign 1 is there should be a well-defined mass effect on the neighboring structures, which was very well seen on these axial images, that it was actually causing compression of the adjacent bowel loops. So well-defined mass effect is sign 1. Sign 2 is constituted by mesenteric fat inhomogeneity compared to the adjacent retroperitoneal or mesocolonic fat, that is misty mesentery. Typical misty mesentery appearance is actually sign 2. Sign 3 is small soft tissue nodes which were seen on post contrast images very well. Sign 4 is the hypoattenuating fatty halo sign, that is perivascular fat sparing. It's called the fatty halo sign. Sign 4, which was also seen. Sign 5 is hyperattenuating pseudocapsule, which may surround the entire entity. So as we saw, the entire entity was very well confined. It's actually a pseudocapsule. It's not actually a true capsule. It's a capsule of fibrous tissue which surrounds the entire entity. It was not very well appreciated in these images. And the last 2 signs are considered inconstant also, but they're relatively very well, they're very specific for the diagnosis of sclerosing mesenteritis. So that is the Coolier's criteria for the diagnosis of sclerosing mesenteritis. Mass effect, misty mesentery, small soft tissue nodes, halo sign, and a pseudocapsule. So differential includes a malignant mesenteric involvement typically seen in lymphoma, and it can be differentiated by FDG PET, where there will be FDG avid uptake in case of malignant mesenteric involvement, while it will not FDG will not be taken up by sclerosing mesenteritis or any of its stages.